So thank you very much. This is a change of pace from the previous session. And I'm going to be talking about Evan in a very different role, an important role. And just to introduce that, we did have a few, oh yes, you do have the overheads there. Thank you very much. So, I mean, I've had the honor and the pleasure of working with Evan in his previous role as Aboriginal physician advisor to my office for, is it about 5 or 6 years now, Evan? Yeah. And it's been great. And if I could move to the next slide. I'm really delighted that Evan has been appointed as a Deputy Provincial Health Officer under the Public Health Act to work with me in my office and to work with the Interim First Nations Health Authority and to work with folk in this room. The appointment has been a fairly long time in the making. It started way back with the signing of the new relationship accord in 2005, when the government made a commitment to work together with the First Nations leadership to improve the lives of First Nations and Aboriginal people in British Columbia. There have been a number of plans and accords signed since that time. The BC Tripartite Framework Agreement on First Nations Health Governance was signed, and that contained in the agreement the commitment by the province to create the First Nations Aboriginal Deputy Health Officer. And the creation of this position is another step forward in First Nations taking control of their health and healthcare services. And BC is actually the first jurisdiction in Canada to take this position. And I'm just going to briefly outline what the roles and responsibilities will be for Evan as the First Nations and Aboriginal Deputy Provincial Health Officer, and how this will support the larger goal of First Nations health improvement and moving to have control of health services and improve health outcomes. So if I could go to the next slide, please. In many ways, this role, which was worked out between my office, the Ministry of Health, and the Interim First Nations Health Authority, although it was the First Nations Health Council then, is a continuum of the work that Evan has been doing and the role that Evan has been playing as an Aboriginal health advisor. But in addition now, Evan has the powers of the Provincial Health Officer as outlined in the Public Health Act of British Columbia, which gives us, and I would also mention we have Dr. Eric Young as my other Deputy Provincial Health Officer, really interesting and fairly unique powers across British Columbia in terms of speaking out in an individual role about health issues, about health status of the population of British Columbia, making recommendations and making reports in any way that we feel is most appropriate. So I'm delighted that Evan's joining me in that role and working for you in that role. And he's going to be reporting on health and well-being of First Nations and Aboriginal people, informing policy development, working to help develop provincial public health initiatives, looking and developing best practices in health improvement, and developing and working with the First Nations Health Council on people to develop newer and more appropriate measures and indicators, and also developing the next iteration of the First Nations health goals, working with folk to do that. So I can go to the next one, please. In addition, some of the other roles and responsibilities that Evan will take on is providing expert advice on the transition to the Interim First Nations Health Authority, or from the Interim First Nations Health Authority to the First Nations Health Authority, assisting with the transitional planning with a particular emphasis, I think, on the roles of First Nations medical health officers and environmental health officers. Providing some expert advice on the statutory options for a First Nations Health Authority under the Public Health Act, and ensuring the linkage of the Office of the PHO in the development of annual tripartite progress reports and also working to create or further develop the First Nations health research agenda. And while this position is sort of officially based in Victoria, I can assure you that Evan will be spending significant amounts of time on the Lower Mainland with the First Nations Health Authority and in various communities around BC. I think as well he could play a significant role with First Nations medical health officers as they develop or improve or get more statutory responsibilities. So what do we hope, or what does the Accord hope will be different by 2015? I think this is taken from the documents that you're familiar with. So we need a greater input, a greater involvement, greater control, a reciprocal accountability, which is really important. I've heard Grand Chief Doug Kelly talk about that. With clear mechanisms for working at various levels in communities with regional health authorities and centrally. Making sure that not only do we identify the gaps, but the gaps can be addressed to the fullest extent possible with new program that's designed, delivered, managed by First Nations people. And that the First Nations communities will then develop improved health programs and will see improved health outcomes. The big picture, I think, is that moving forward with this position gives another tool, another input, another power, if you like, for the goals that we share for improved health status to actually be realized. Closing the gap is the important piece. I would also say that Evan has been a part of what's called Health Officers Council, which is the public health officers, medical officers across British Columbia. And they were extraordinarily welcoming and pleased when Evan was appointed, when we announced that Evan was appointed. And I would also say that they were very much looking forward to seeing the First Nations Health Authority have some statutory authorities and powers under the Public Health Act. And they really welcome the First Nations medical health officers and the environmental health officers under that act as well. So we are supportive of that, looking forward to that, and hoping to see that in the not-too-distant future. So having just outlined the roles that Evan will be playing with my office, with the First Nations Health Authority and communities, I'm going to stop there and turn the microphone over to my colleague, Dr. Lloyd Opal. Thank you.